friends, this is Dr. Abdequaem. Today, let's study one more drug which I prescribed in a case, a very interesting case where the patient had everything, all symptoms related to the precordium in relation to the heart. When he entered this chamber, yes sir, he told me, I have constriction, that there is tension and tightness in my heart. बहुत मेरे हार्ट में से टाइट लगता है. I said okay, something more. नहीं सर, बहुत टाइट लगता है, ऐसा लगता है कि कोई दबा रहा है ऐसे हार्ट के अंदर मेरे. I said okay, और कुछ सर कभी कभी लगता है इतना हार्ट में दर्द होता है कि वो फट जाएगा. I said okay. फिर आपको क्या लगता है, मतलब what do you feel as if? So what he was trying to tell me, a very tightness feeling in the region of heart, a pressure feeling in the region. He said there is so much pressure that sometimes I have to, I can't bear the pressure. I have to stay silent so the pressure gradually passes off. There is so much pressure in the region of the heart. It feels as if something is there. There is consciousness of the heart. There is so much of pressure there. And there is bursting pain sometimes also in the region of the heart. And sometimes I feel that the pressure is so much that it is compressed and there is no room. There is no room for the blood to go around in my head. It is so constricted. ऐसे दबाया हुआ, टाइट स्क्वीज किया हुआ लगता है. That means he was telling me that there is no room for the blood to move around the heart, to move around the aorta. That was the symptom the patient was trying to tell me. I said something more. He said, I feel lot of anxiety. Whenever there is something, I feel anxiety in the chest. Whenever something is happening, whenever I feel fear, there is anxiety in the chest. Whenever I have to do something and I think, well, I'm not able to do it, there is anxiety in the chest and the pressure starts. So everything related to anxiety in the chest. I asked again, what is that feeling that you feel that is the blood is in the heart? Sir, I feel that the blood is stagnant. The blood has no room to circulate. He feels that way. I said okay. Anything else would like to add? He said, sometimes I feel there is lot of squeezing in the region of the heart. So I said that you have told. Anything else? So if you see the symptom functional, it is different. If you see some pathology involved in it, that means it is possible that there may be atherosclerosis, arteriosclerosis, where calcium has been deposited in the arteries, in the aorta or in the coronary arteries, and the blood has to flow against the resistance, and that's why there is lot of stress, there are lot of pressure, lot of constriction, lot of squeezing, and lot of tightness sensation in the region of the heart. So the next question should be, if it is because of arteriosclerosis, and so the patient must suffer from blood pressure also, because this may rise the systolic and diastolic blood pressure. And asked him, because of this sometimes you feel that your pressure is rising? I say, yes sir, my blood pressure also increases. Sometimes it is 150 by 86, sometimes it will be 150 by 94, 150 by 100 also sometimes. And I was thinking also to go to a doctor and start my blood pressure medicines, but I first tried to take homeopathy, so I don't have to take the other allopathy medicines. I said okay. So the case was going in the right direction. So we wanted a drug which should cover the symptoms and the pathology also, that is hypertension or arteriosclerosis, that also should be covered. And the symptom anxiety, whatever happens, he feels anxious in the chest. I said, tell me something about the dreams if you have. I said, I have something very peculiar when I sleep. I said, okay, what? He said that sometimes I feel that yesterday he told me that I had a dream that I was making one mud toy. I made it half and suddenly the dream stopped. I said, so what? What is there peculiar? I said, no sir, every time I get such type of dream only. That means once I get a dream that I am solving a paper and I have written the half answer, and that I cannot solve the full answer. I said, okay, something else. He said, once I got a dream that I was playing cricket and just I was about to hit a shot, the dream stopped. I said, what sort of dream is this? I said, sir, I get this type of dream only. Once I got a dream that I was finishing my table work, that means I was doing some repairing of table work, and I repaired the half of the table, and then suddenly I woke up. I get this type of dream. So I was thinking whether these type of dreams are present in a Mathematica, playing half of the cricket shot, table work half done, question answer half written. So I said, any other dream which you get? I said, no sir, I get these type of dreams only. I have gone to drop my child to the school, and then suddenly in the halfway I wake up from my dream, and dream stops if I don't wake up from the sleep. So these type of dreams the patient was trying to tell, and I could not define what was actually the patient trying to tell me. So I said, okay, fine, forget it. Something else. He said, sir, these days since this complaints, my digestion is very slow. I have a lot of gas problem. Digestion is slow. I think my liver is weak. He was telling that way. And I said, something you desire to eat more? He said, I love chocolate, sir. I like to eat lot of chocolates. So this was the case in front of me. Now what actually the patient was trying to, first part of the symptom of the patient was trying to tell is related to heart, and heart was very easy to repetize because we had to just put in the blanks and we could get the drug. So when I put these symptoms on the paper, the symptom which I put was constriction and tension, tightness in heart. Second, pressure in the region of the heart. Third, pain bursting in the region of the heart. Fourth, pain pressing in the heart. And fifth, anxiety in the chest because of pressure. Now one symptom which I told you where the patient was telling that the blood had no room, I said, let me see this symptom, it is there in the repertory, and I repetize this symptom, and to my utter surprise, this symptom was there in the repertory. The symptom was compressed sensation in the heart. Blood had no room in the aorta. What a wonderful symptom in the repertory. Blood had no room in the aorta. And I was so happy when I got this symptom because I knew that I had got the remedy. Of course, then I put that rubric arteriosclerosis, that is there. I've put the rubric hypertension, that is there, in order to get the complete case, and it desires for chocolate. And to my utter surprise, that drug, I had read that drug in my college days, but I never thought that this drug will cover all this symptom, because normally whenever the symptoms of heart strikes in our mind, we generally think about the polygast remedies like Cactus grandiflorus, like Dietalis, like Cratacus oxycanthide, like Arjuna, like Lachesis, Crotalus, Cactus. These drugs, Spigelia, Kalmia, these drugs come, Strophanthus, Laurocerasus, Iberis, these drugs come to our mind. But my friends, when I repertorize all this symptom, especially that symptom of compressed sensation in the region of the heart, the blood had no room to move the aorta, and the drug, you must have guessed it right, the drug which came in the repertory sheet was Vanadium. And Vanadium 202 doses in the interval of 1 week. The patient came after 15 days and he told, sir, that pressure, that tightness, that constriction, that anxiety, everything has come down. Now I feel light in this area. What was he telling? I feel light in this area. Now I can breathe properly. There is no load and pressure sensation in the region of the heart. Then I asked him, how about the pressure? So he said, sir, please check it. I'm going to check the pressure. the pressure was 140 by 86, and he said it is normal, sir. I have never touched down to 140. And in about 4 months time, the pressure came down to 120/80. All the symptoms came down to normal, and the patient was relaxed, and he was very happy that he did not take any allopathy medicine. So this is the case, Vanadium. Please do read more symptom of Vanadium in order to be very sure when you prescribe Vanadium. If you like this video, please do share and subscribe so that people can learn Vanadium through this case. Thank you.